Hi, I'm Ingrid Winship. I'm a clinical geneticist, and I've been a visiting medical officer at Epworth Freemasons for about 5 years now. More recently, I've been joined by my colleague, genetic counsellor Adrian Sexton.
My name's Adrian Sexton. I'm a genetic counsellor at the Epworth, and I've joined Ingrid here and helping Epworth patients with their questions and options about genetics. So DNA is the instructions in all of our cells, and within the DNA there's lots of different sections of that DNA code that's called genes, and each gene has a particular function in the body. And so in the DNA code sometimes there's a problem that stops the gene working properly, and that's what genetic testing is looking for. If there's a problem in the DNA, maybe it's stopping that gene from doing its job, then somebody might have more likelihood to develop a particular health condition.
I think a very accessible analogy is that the genome, so a genome of one individual, is unique unless you've got an identical twin, and it's like a library. So the library is the whole genome. The books are the chromosomes, so in paired volumes. So you've got one of each chromosome from mum and one from dad for every one of your 23 pairs of chromosomes. And then when you open the book, a page of information is a gene, and the letters, the alphabet that the genes are written in, is your DNA, G, A, T, and C. So a pretty simple alphabet. And as Adi says, we're looking for spelling mistakes in that set of instructions, which will alter the impact on health. Maybe, Adi, you could explain what is involved in having a genetic test.
It's pretty simple, isn't it, that genetic testing can be done by either a saliva test, and some labs that we use will send that to the patients in the mail, and some are done by blood tests. So it does depend a little bit which type of test and which lab, but mostly not too much involved in having the actual test.
We were joking earlier about Punnett squares, and although we don't generally draw out a Punnett square, I have a little Punnett square in a little piece of my brain, and I use it quite frequently to work out risk. So I have an inbuilt Punnett square.
That's handy.
but we have a number of other tools like family history, but then algorithms. So perhaps you could tell me about CanRisk and other algorithms and models that we might use.
Yeah, definitely important for cancer genetic counselling that we do quite detailed information gathering in terms of asking about the family history details, and we use that in terms of putting it into a program that we use. It takes all the information that we've got and puts it together based on evidence that's available from around the world, to say what's our best estimate of this person's chance of breast cancer. And then that really helps much more accurate advice to them about what category of breast screening to do, whether there might be any preventative options. So really important part of what we're doing behind the scenes, before or after the appointments, and then we're writing that back to their healthcare team as well, aren't we? So that they've got that information to go on.
It caters for all tastes. So some people are information seekers and they want 2 decimal points.
Yeah.
And others would just like categoric risk, like population.
Yeah, high or low.
High risk, moderately increased, that sort of thing.
Yeah.
And so part of what we do is assessing what the expectation of the individual is, as well as servicing the needs of their referring doctors, who would want to have quite accurate figures in making decisions. Sometimes people on the basis of genetic tests do irreversible surgery, such as have their breasts removed or maybe their ovaries removed as a risk management strategy. And we have a responsibility to give as much information and as accurate information as possible so that these decisions are made on the best possible information. One of the things that troubles us as health professionals is people not being prepared for the results that they get. And this is where the role of the genetic counsellor is so important. As a clinical geneticist, I'm a physician, I'm a medical doctor, and I have a medical approach. Adrian is a genetic counsellor, so she's a health professional with extensive counselling skills. So perhaps she could tell you a bit more about. So, Eddie, what actually does a genetic counsellor do?
Yeah, genetic counselling is mainly about personalising the genetic information for people. So making sure that we can answer people's questions and worries, and sometimes provide reassurance that a genetic cause might be a quite low chance, but doing that while taking into account the family experiences that they've had with cancer. And sometimes there's a lot of grief and worry and distress that has come with that over a long period of time. And so it's really important to factor in what does it mean to them when they think about genetics in the family. What are their main worries or motivations for getting the test? And how would they feel about the different types of results that can come from that? And I think that's where we work really well together, isn't it? Because we can think about all the things that's relevant for the person's emotional and familial and medical outcomes.
Yeah, that's right. I mean, we've actually worked together for 15 years, so we can finish each other's sentences. And we're very much aligned. We have the same philosophic view on creating a holistic model. But Eddie, you mentioned cancer, but you're an expert in neurogenetic conditions. So what about neurology? What about inherited disorders, neurodegenerative dementias, things like that?
Yeah, really important area of genetics, because a lot of people are concerned about a family history of dementia or other conditions, and there's a lot of genetic testing available for that now that people often don't realise. So I'm really interested in that area, and see a lot of people with a family history that might include Parkinson's or ataxia, or that's problems with movement or balance, or problems with thinking and memory. Lots of different conditions, sometimes rare conditions like Huntington's in the family, where people already know there's a gene and they're weighing up whether to have a yes or no test to find out if they have the gene too. So honestly comes with a lot of emotions, a lot to think about, and several counselling appointments before going ahead. And that's following international guidelines that we have to be able to do that.
One of the things that people don't really understand is what it takes to become a genetic counsellor. This is not a 6-week course. What did you have to do to become a genetic counsellor? And maybe not specifically you, because Eddie's a PhD scientist, which is not essential. But to be a genetic counsellor, what sort of education do you need?
Genetic counsellors have a 2-year master's, which combines a lot of genetic knowledge and counselling skills. It's based on a lot of counselling theory, so that we can make sure that we're really able to do the job properly in terms of both aspects, counselling and knowing about the genetics, interpreting the results, putting that all back into everyday language so that people can really feel like they're empowered with their own health choices. Question for you, Ingrid. Could you give an example of a familial condition and just talk a bit about that?
Well, I'm biased. I think everything's genetic.
Yeah. Well, you're a geneticist, so
I can find
and
the
that
gene.
is actually true anyway.
I
mostly.
can find the gene in everything.
Yep.
Oh, look, there are many conditions that are purely genetic, where there is an inherited condition. You mentioned Huntington disease, some of the ataxias, where there is a single gene, which if it has, and people talk about having the gene, which is shortcut for having a pathogenic, i.e. disease-causing variant in a gene associated with a medical condition. So if you have the genetic profile that would cause, say, Huntington disease, fortunately very rare, although quite well known, that is inherited at a rate of 50-50 from parent to child. Other times it's a predisposition. So we've talked a little bit about breast cancer. You may have, with the BRCA1 gene, an inherited predisposition to breast and ovarian cancer. That doesn't mean that the gene change will cause cancer, but make you more likely to develop the cancer over your lifetime and possibly at a younger age.
Yeah, so you can, if you know about that, you can put those safety checks in place, a safety net of screening and prevention, and have the right care with the expert team.
That's absolutely right. And we have, again, a responsibility to use evidence-based pathways. So where there is evidence that something is helpful, that's what we use. If there is no evidence, sometimes we use best practice guidelines and sometimes empiric advice, but we have to be very clear with people that, and particularly with irreversible procedures like surgery, there needs to be a strong evidence base to justify such an invasive way of doing things. But the bottom line is that we're not only about surgery and risk reduction, we also are about empowerment, as Adi said, and advocacy. So we are here to look after the holistic needs of our patients.
And their families.
And their families, of course.
So I've got a question for you, Ingrid. How much does genetic testing cost?
Well, that's a little bit of a variable. It depends what the genetic testing is for. A lot of the work we do here at the Freemasons is in familial cancer, and typically the panels of genes that we would look at, that is a cluster of genes that may answer the question that your doctor and you have put to us about a possible predisposition. Most of those are about $450.
Yeah.
Some of the bigger panels are a little bit more. Of course, there are other tests that can be done, and for other medical conditions, they may be more expensive. A very few tests on our Medicare build, and we're hoping that more genetic tests will get onto the rebatable list in the future, which makes me think of another question to ask you. You've talked about neurology, you've talked about familial cancer, but is that the whole extent of it? What else could we be working with? What other medical areas have high levels of inherited disease?
Yeah, excellent question, because genetics is really now so important across all areas of medicine, isn't it? It's including things like pre-pregnancy tests, but also single gene tests for other rare conditions, lots and lots of different areas of medicine, cardiac conditions, that's heart diseases, diabetes and other conditions like that. Yeah. You can probably think of more as well that I've missed there.
So certainly some of the cardiac conditions do have Medicare rebatable tests, and where there's cardiomyopathy, sudden cardiac death in the family, it's sometimes helpful to know about the genetics. And of course, it's not only the genetic test, but what we do from years of experience with family history and other collateral information is firstly a risk assessment and then a risk management plan. Of course, we also have a diagnostic side, but that's more the diagnostic work is done more by the physicians, and the counselling, making sense of it, is done by the counsellors.
That's right, because with working out how likely something is in a family, that's really important when helping people weigh up whether it's worth it to them to go ahead with testing, isn't it? Because sometimes we can provide information that the chance might be quite low, and then people think, well, maybe I won't go ahead. That's really reassuring to me and to my family. And other times people want to know anyway, and they say that might be for peace of mind, or knowledge is power is the other common thing people say, isn't it?
Absolutely. But I think one of the real issues is if you don't know what your risks are, then you can't adequately manage them. And so good risk management is predicated on good risk assessment, which may be done through a number of areas, including genetic testing. Our service runs on referrals, and certainly for me as a physician, for patients to get their Medicare rebates, I must have a referral. Referrals can come from GPs or specialists, and that's pretty straightforward. Medicare does not rebate the cost of genetic counselling services, so AD is actually much more flexible. Genetic counsellors are much more flexible. Ideally, they are by referral, and again, the same doctors will refer a patient to me for one thing and to Adrian for another, because we provide two different pieces of a two-piece jigsaw puzzle. But AD, it can actually take self-referrals as well, which is very nice, particularly if somebody's been on the genetic journey and feels that they need to have some discussion, they can phone the Epworth Freemasons clinic on the first floor, Epworth Freemasons Health Clinic, and make an appointment.
So I've got a question for you, Ingrid. What do you think is the biggest innovation in genetics in the last 10 years?
That's a very good question. I've been in this game for 40 years, and my job now is nothing like it was 40 years ago, or even 10 years ago. I think the biggest innovation is in testing, is in massively parallel sequencing and next generation genetic sequencing, which has made testing cheaper, quicker, more effective, and made genetic testing more accessible, more equitable, and improved access for more people.
Yeah, it gives people a lot better choices about what tests they can have, and whether they want to, what information they can get from those tests is a lot more accurate now as well, isn't it?
That's right. I mean, you can remember 10 years ago when just the BRCA1 and BRCA2 genes cost $2,500 to test.
Yeah.
And now you can test a panel of 10 breast cancer predisposition genes for $450.
It used to take 2 years as well to get genetic test results for those two genes, and now we get results in a couple of weeks.
6 weeks usually. People are used to getting their results from the doctor tomorrow.
Yeah.
Genetic testing is not quick. I can't stand CSI because they give false expectations.
Yes.
They do DNA tests in 5 minutes. We can't. We do use only accredited laboratories to do the testing, so there has to be a premium product, which takes time, and so we use laboratories that have slightly slower turnaround times, but we really trust the results when we get them.
Yeah, that's true, isn't it? Because a lot of people do look around on the internet and things for what tests they could order themselves, but it's really important to know the quality can really vary, and a lot of those labs don't have all the checks and balances that we would want for the types of tests that we're doing and for the types of really important health information that families can get from that.